Good afternoon, legislators. My name is Layla Mandich, and I'm a nurse practitioner student at Texas State University. I have a new policy brief to share with you regarding nurse practitioner programs. Imagine an engineering student paying tuition to a professionally accredited university just to find out they must find their own math professor to teach them key material. Quite unjust for an accredited university to fail in providing the key component of the education required. Yet this is happening to our nurse practitioner students, a profession which is meant to provide a cost-effective solution to a lack of healthcare accessibility to millions of Americans. Just like medical students and residents, clinical hours are arguably where the most learning truly occurs. It is a space to take knowledge from the classroom into the real world, to gain experience collaborating with different members of the healthcare team, and have hands-on experience with patients in a safe environment. A nurse preceptor is needed to facilitate this experience. Yet, most NP programs pass the burden of finding a preceptor onto the student. As it stands, there's little incentive for licensed providers to take time out of their busy day to teach students who have contacted them by cold calls. A loss of productivity, a logistical and legal struggle, there are numerous barriers present. The policy I propose will require universities to guarantee preceptorship for all students accepted into the program in order to be accredited. The university will have to leverage their power to gain affiliations with facilities and build those relationships, perhaps even hiring the preceptors on as permanent faculty. It is true there is a shortage of preceptors. Therefore, we will need government support as well to encourage participation across the spectrum, from smaller independent facilities to large-scale hospital networks. This will come in the form of tax incentives and increased Medicare/Medicaid reimbursement for providers who take nurse practitioner students. Through this policy, more student slots will be opened in clinical sites, allowing universities to more easily negotiate these affiliations and advocate for their students. It is time to make an investment into the education of our future healthcare workers.